Ministry of Health of Ukraine. Krok 2. Medicine. Year 2020, number 109. A patient 1 year ago had a Q-wave myocardial infarction of the posterior wall of the left ventricle. For the last 2 weeks he has been suffering from daily attacks of atrial fibrillation and bradycardia episodes, accompanied by bouts of vertigo. What tactics is the most advisable in this case? A. Prescription of procainamide. B. Prescription of amiodarone. C. Pacemaker implantation. D. Prescription of bisoprolol. E. Prescription of digoxin. Myocardial infarction, heart attack, is caused by decreased or complete cessation of blood flow to a portion of the myocardium. It can be due to underlying coronary artery disease. With coronary artery occlusion, the myocardium is deprived of oxygen. Prolonged deprivation of oxygen supply to the myocardium can lead to myocardial cell death and necrosis. Over time, the coronary arteries can develop plaques, buildup of cholesterol, fibrous tissue, and inflammatory cells in a process called atherosclerosis. Smoking, high blood pressure, high cholesterol, and diabetes are risk factors for atherosclerosis. The blood clot may block the coronary artery and starve the heart muscle of oxygen and nutrients, resulting in a heart attack. Symptoms of myocardial infarction: chest pain or discomfort that spreads to the shoulder, arm, back, neck, jaw, teeth, or sometimes the upper belly. Shortness of breath, coughing or wheezing. Sweating, nausea, vomiting, fatigue, weakness, anxiety, stress, depression. Complications of myocardial infarction: arrhythmias, cardiogenic shock. The heart's muscles are severely damaged and can no longer contract properly. Heart rupture. The heart's muscles, walls, or valves split apart. Diagnosis of myocardial infarction: when 2 of the following criteria are met. Symptoms of ischemia, new street segment changes or a left bundle branch block, LBBB. Presence of pathological Q waves on the ECG. Imaging study showing new regional wall motion abnormality. Presence of an intracoronary thrombus at autopsy or angiography. Atrial fibrillation is a risk factor for myocardial infarction. Indications of pacemaker implantation: sinus node dysfunction, acquired atrioventricular avenue block, chronic bifascicular block, after acute phase of myocardial infarction, neurocardiogenic syncope and hypersensitive carotid sinus syndrome, post-cardiac transplantation, hypertrophic cardiomyopathy, pacing to detect and terminate tachycardia, cardiac resynchronization therapy in patients with severe systolic heart failure, congenital heart disease. The answer is C. Pacemaker implantation.